This is New York Nightly News with Chuck Scarborough, live on New York Nonstop.
Less than 2 weeks after surviving an assassination attempt that left her with a serious brain injury, Congresswoman Gabby Giffords is on her way to the next phase of her recovery at a Texas rehab center, leaving behind the Tucson hospital that saved her life and a community that's cheering her on. Jay Gray has the latest from Houston.
Surrounded by the roar of a motorcycle escort and well wishes from hundreds who line the route to Davis-Monthan Air Force Base.
It's important for Gabby to know that we're behind her. We're supporting her in her recovery efforts.
Gabrielle Giffords, her family and medical team left Tucson for Texas and the next step in her recovery.
It's a bit of a wait-and-see game. It's always a mystery exactly how things are going to turn out.
A mystery that will take its next turn in Houston, where Giffords landed this afternoon and was immediately transferred to a waiting life flight chopper that rushed her to the trauma center at Texas Medical Center.
We're going to do a detailed report from what happened during the transfer, what are some of the issues we need to think about.
Next, she'll begin intense therapy at the renowned Texas Institute of Rehabilitation and Research at Memorial Hermann Hospital.
We're eager to start a comprehensive rehabilitation program that will take into consideration not just the physical recovery, but also the cognitive and emotional recovery.
It's still not clear if Giffords can speak or just how much she can see or hear. And while she's been able to move both arms and legs, even stand briefly, doctors still aren't sure how much strength Giffords has on the right side of her body. The first order of business for the medical team at TIER will be to evaluate those basic functions.
We ask questions, we review records, we perform examinations and see what the person can and cannot do.
As Giffords begins the long and difficult transition from recovery to rehabilitation. A process that her doctors agree will continue for several months here. In Houston, Jay Gray, New York Nightly News.
Here to talk about the road ahead for Gabby Giffords is Dr. Anders Cohen. He's the chief of neurosurgery and spinal surgery at the Brooklyn Hospital Center. Doctor, welcome.
Good evening.
I've got to tell you, I'm just stunned that 13 days after she was shot through the head, she is off to rehab. How often does that happen?
That's very unlikely, and she's bucked a lot of the odds to make it this far, this quickly.
What sort of odds has she had to overcome with that kind of a brain injury? Because I gather it was the left side of her head through the brain.
Sure. I would say almost 50% of these people don't make it to the hospital and die shortly after. Another fair segment of those will survive but have significant and possibly permanent impairment and maybe never wake up. And a small percentage of them can recover and actually make meaningful recovery, and hopefully Congresswoman Gifford is one of them.
Can she regain speech? Is that possible? Because I think isn't the speech center on the left side of the brain?
Well, that's the big question, because the bullet passing through the left frontal lobe can affect speech, but the big issue now is what was Congresswoman Gifford's true brain dominance. If she's left brain dominant, speech will be much more imperiled than if it was not.
All right. I don't think she's formed words yet, but she may be trying to form words from some reports. She had something called a craniectomy. Tell me what that is and why that's necessary.
Craniectomy is a Latin term for meaning that when the operation was performed, the bone was removed and not placed back on at the end of the surgery.
The skull, part of the skull.
That's correct. And the reason for that skull not being put back in was to allow the brain swelling, which we know is going to occur after the injury and the surgery, to run its course. And then when the brain swelling comes down, that piece of bone can be replaced much later. So
now she has some surgery ahead of her to get the skull rebuilt. When the swelling's down, right?
That's correct. At some point, they'll put either that piece of bone or a synthetic piece of bone back to protect the brain.
So what is the most important thing for her right now when she gets into rehab?
Well, in this next phase, it's really going to be a comprehensive team of physicians and therapists, and each one will have a specific duty of evaluating cognitive recovery, speech and movement, also speech and swallow, because we know she has a tracheostomy at this point as well.
Have you ever had a patient who has had a gunshot wound through the brain like that, who has made as much progress as rapidly as she has?
I have, but again, statistically, it's maybe been one out of many.
Yeah. What are the continuing risks that she faces as she goes through this process?
Well, I think the immediate life-threatening risks, which were brain swelling and infection, are pretty much past at this point. We as physicians worry about the comorbidities, which are patients that survive but then get a pneumonia or blood clots. I think by her getting to rehab now is a significant improvement of her not having those. But now the next phase is really the wait and see and the long process of trying to recover function.
All right, Dr. Anders Cohen, thanks for coming in. Appreciate it.
Thank you.